So I'm Dr. Gates, I'm a chiropractor, I also have a degree in kinesiology, health studies, and psychology. I went to school for a long, long time. Okay? And I've been in practice now for 27 years. That's unbelievable. I'm probably older than most of you guys are. So, but I want to take you back to a talk that I was using for Waterloo. I think I was 20 or 21 at the time. And it changed my idea as to what health was, and it changed my idea as to why I became a chiropractor. So this is me, I'm 21, so I'm in much better shape, I'm looking good, I'm exercising every day, everything's wonderful. And we had a guest lecturer come in from McMaster University, and he's a medical doctor. And he wasn't that good of a speaker, but he talked about health. And there was one little section in it that really was powerful for me. So I'm going to tell you guys what it was. So what happened is, in fact, he came in and he asked, and we're all young, we're all like you guys, I don't know how old you guys are, but 20s, imagine something like that, we're all doing well, enjoying life, it's all good. He said, how many people in this classroom are healthy? And I put my hand up and said, yeah, I'm very healthy, I'm in great shape. And he said, there's about 40 people in the class. And he goes, how many people in this class are unhealthy? And 2 or 3 people who had colds and flus put up their hand, and I said, oh, okay. He says, great. He says, so what? He says, so what makes the people healthy and the people sick? And this is a health studies class and whatnot, so we're all, this guy's a goofball, we're all studying this. And one keener in the front row put his hand up, says, because if you're sick, you're not feeling good, and if you're feeling good, then you're healthy. And the teacher, the professor, or the guest lecturer stood up and said, how many people think that is true? That if you're not feeling well, that you're sick. And if you're feeling with no pain at all, then you're healthy. And geez, everyone in the class put up their hand. And I remember, this is like 35 years ago, this is a long time ago. So he drew a big line across the blackboard. He put down on one side and drew a line all the way across, and he put wellness over here. And he said that they were trying to change the way people think of healthcare. And he said, I'll give you an example. So this is his example. This is 35 years ago, and he's a medical doctor. He said, I had a patient come in who's a 29, 30-year-old lady. She's a mother of 2. She was outside yesterday playing with her kids in the snow. She got some snowflakes, telling me how great it is. And we're like, oh, that's wonderful. And you think, so do you think she's really healthy? She has no pain whatsoever. She's feeling wonderful. And we're like, yeah, okay, great. But he says, when she came into my office, I had to tell her that she had stage 4 pancreatic cancer. So she close to, let's say, we have death over there and wellness over there. So she's feeling really good, but he goes, she's close to death, but she's in no pain. And all of a sudden, I'm sitting there in class, and all of a sudden, I sort of wake up. I was like, oh my God, this is going to be a pretty good lecture. It's pretty interesting stuff. Then he goes, let's say if you're an Olympic athlete or a professional athlete, and you're in great shape. You're 21, 22, you're going for a run, you're feeling absolutely wonderful. On the 14th mile of your run, you trip over a rock, and you break your finger. You're in agony, you're in pain, right? He goes, now is that guy there towards death, or towards wellness? And I think, well, he's pretty close to wellness. He's feeling great, he's got a broken finger, he's in pain, but he'll get over that, he'll look great. So at that moment, I was sitting there going, this doesn't make sense to me. All my life I thought that if I'm in pain, then I'm sick, and if I'm not in pain, I'm healthy. And now I'm sort of, my mind's sort of going, wow, this is craziness. So I went up to him after the lecture, and I said, that was kind of interesting. I said, you know, that kind of keeps my mind on what I do in healthcare has. I said, what professions out there promote this? And he said, there's 3. He goes, there's dentistry, which you guys aren't like in, your dental assistants and hygienists, which is wonderful. And he said, they promote moving people towards wellness care, regular checkups. You know, a lot of your practice will be seeing people, even though they're pain-free, they're coming in for checkups, which I think is wonderful. He said, McMaster University, he said, is the #1, and that was the school he was going to. He said, the #1 for a profession, a school out there which promotes wellness. And they've done, and I know a lot of MAC MDs, and they've done a good job. So I applied to MAC and as an MD, and I got in. But all he also did, the 3rd profession was being a chiropractor, because they also promote wellness. Now, I wasn't big on chiropractic at the time, but the more I read about it, the more I enjoyed it. I enjoyed the philosophy of moving people towards wellness care. And much to my mother's chagrin, she wanted to become a mental doctor. I became a chiropractor, and I love it. So I tell people now, I said, that's what got me into being a chiropractor, which is the exact same philosophy as what you guys are doing. Because I would say probably 70% of your practices when you guys graduate will be seeing people on a regular basis. They're coming in for regular checkups. And that's where my practice is. I see 70-80% of my practice come in, people are asymptomatic. They're pain-free. They come in originally because they're in pain, there's no doubt, but they're asymptomatic. and then moving people towards wellness care. So when Eleanor asked me a couple of weeks ago whether or not I'd be interested in giving a talk to you guys, and I said, I used to give a lot of talks, but now I don't give all that many. I said, I don't know, who's it to? And she said, it's dental assistants and dental hygienists who are still in school. And I laughed because there are 3 professions I see in the office a lot, more than anyone else by far. Teachers, for sure. Number 2 would be nurses. But a big one I would rank right up there are dental assistants and hygienists. I see a ton of you guys, a ton over the years. I've been in practice for 27 years now. And I always wondered, so, first of all, I want to thank you guys and your profession. You support my family very well. Thank you very, very much for that. So, but I know, and I thought, why do I see more of those people than I do anyone else? And there's 3 reasons people come in to see me. Number 1, they're born with a problem, so I see the odd baby who will come in, there's some issues, scoliosis and whatnot, which is great. I see them getting better. Major falls or accidents, car accidents, people fall off a horse, I see a lot of that also. But you know what I see 80 to 85% of people who come into my office now? Poor posture and stress. Those 3 professions, which you're one of, have an incredible amount of stress, right? We're coming in, and you guys are working with somebody else, you're working for yourself. It's all a matter of moving people in, moving them out, giving them quality care, and the stress also is huge. And posture is the other aspect. Very, very poor posture. Because what's happening is you guys are sitting there, spending your entire life, or a big chunk of your life, looking through a 4-inch opening in someone's mouth, trying to get them feeling better or functioning better. So let me just show you. So this is your spine here, okay? Are you guys familiar with the anatomy of a spine? Have you learned that? Yeah? Okay, great. So I've got some trivia questions after. Thanks very much. You're going into not. Okay, so your head's up here, your back is here, your front is over here. From the front to the back, your spine should be dead straight, okay? And your pelvis should be level. In the neck, you want a nice C curve, which is called a lordosis. Have you guys learned that? No? Oh, it's not. Okay. A lordosis, you have a kyphosis and a lordosis in the lower back. That's the natural curvature. But what ends up happening when you're sitting down in an awkward situation, as you guys will be, looking into someone's mouth, is that your head is here. Your head's the weight of a bowling ball. Okay, so you can imagine a bowling ball, and the person's mouth is there, and you're trying to look through it. You're sitting down, and your head is moving further forward. Right? This is your posture for a long, long period of time. So what ends up happening over the course of time, your spine, which should have a normal lordosis in it, it becomes what we call kyphotic, further forward. So the white things here are the bones. You see those? Okay, so further on down, the white things get bigger and bigger. You see those? The disc spaces, which are the shock absorbers, get bigger and bigger open. Bigger and bigger. But the worst part about it is when your neck goes further forward are these yellow things. That's the nerves. So what ends up happening when your neck goes further forward, those nerves coming out will get pinched. And that's what causes pain. Okay? So the nerves being pinched is what causes pain. So if your spine should be like this, and it's like this, you start getting yourself into deep trouble. So do we have there it is right there. So what's going to happen, I'm going to show you quickly some x-rays. I know you guys are big on x-rays also, so hopefully it's a small group, so hopefully you can see this. So what happens is that this is a normal looking neck here, okay? And again, any questions, ask away. There's only 15 of us will ask. The bones are right here, you can see that? So if I draw a line coming up here, it would dissect or go through the top one. So it's a normal curvature in there. That's your neck from the side, right? This is your jaw here, back of your skull, and your neck there. That's a normal looking neck. At phase 1, which I see a lot of assistants, a lot of hygienists come in initially on, your neck is coming further forward. So the neck is much straighter than what it should be. You can see that? But everything is brand new. How do we know that? The disc spaces are all big, the bones are all big. So this is somebody who's come in, probably has a minor issue of headaches or some neck pain, will be working for the first couple of years, but overall it's not too bad. 5 or 10 years later, all of a sudden, we take another x-ray, and the neck is much straighter. You can see that? Well, the difference between this guy and this guy are the disc spaces. You see how they're narrowed in there?
Can you guys see that?
Yeah. You guys you see that? So the upper part looks pretty good. The upper part looks good. The lower part, you can see how thin it is, right? And then this is when it gets nastiness, okay? So this is left alone for a while. It gets straighter, and you're getting some bone spurring. You can see the bone spurs, see those should be square, it's little hooks on the end there. So that's arthritic bone spurring, and then this has got over there. So you want to avoid. Question, wonderful.
Is it reversible? Like, can you?
Oh, a great question. Yes, everyone asking that. Yes, it is. Unfortunately, fortunately and unfortunately. Fortunately, part of it is changeable. So if you're in a stage over here, which is phase 2, we can get you back to here. Very difficult to get from here all the way back. but we can generally get from here to here. The bad news is when you come in over there, it's really difficult because there's so much arthritic changes in there to get you from there to there. Okay, so the quicker that we're able to see you, the more changes that we can make, it easier it is. But yes, it is possible. Okay? Question?
So what's the symptoms of the phase one?
Phase one, that's a great question also. So generally what will happen is the fact you'll have some, just like with you guys, neck pain, occasional headaches maybe more tension headaches across the skull over here. Don't get them all the time, but maybe at the end of the day or in the week, I start feeling it. But overall, it's not too bad. I can sort of function through my day, but I'd rather if it's not there. Look, get some Tylenol a little bit, and they know they're not okay, but it's not too bad. Phase two, it's there on a more regular basis. I wake up in the morning, my neck on the upper back is hurting, I try to loosen it up, I get my husband to massage me, or I get a friend to help me out a little bit, but it's hurt there all the time. I get headaches now 2 to 3 times a week, it's getting worse, it's not getting better. I may get a bit of pins and needles towards the shoulders and down towards the arm, but it's not good. Okay? That's where you are there. And then phase three, those are the ones that, you ask them to turn their neck and turn it a little bit, but they're, they can't turn all the way, and they're having pain on their basis, they know that things aren't okay. Okay? Most people come into my office in this stage, when they come in over there, they already know they have a big problem. Okay? So that's sort of the anatomy of what's happening within the neck area. Any questions? You guys are doing great, by the way. Great. Okay.
Do you need an X-ray to diagnosis, or do you just?
There's various objective tests that we do on people that will ascertain as to what the problem is, and I can palpate and feel the area. But I like X-rays. I like doing objective testing with people so I can see exactly what we're looking at. So I can palpate and do some tests with you and say, yeah, I can tell you right now, I would assume that there's probably going to be over there. I've been doing this for a long time now, that my guess is pretty much accurate. But I still like seeing the X-rays. I like seeing the X-rays, I like showing it to the patient. So what ends up happening is when the patients see it, they go, oh my jumpers. I go, this is normal. They go, no, I'm over here. I go, yes, you are over there. Yes. Yeah. So they can see it, and when they see it, that's when they truly own it. That's when they say, okay, this is not okay. It's not just something wild. I've got a structural issue which is happening. I always tell people, if your spine was on the outside of your body, people will be lined up at the door to see you. With you guys, give the advantage. We'll see their teeth. So if it's not in the normal alignment, they're into your office. Fix it. Get me better, right? In my office, if it's the spine's not in the normal alignment, they feel some discomfort. They're thinking, I don't know what to do. It's not too bad. No one sees it. I'm doing well. If your spine was on the outside of your body, it would help me out a lot. Okay. So any questions so far? No? Okay, good. Okay, a few minutes here, but I see neck pain issues with the low back and low back for sure. Those are the two biggest. Carpal tunnel, you guys are familiar with carpal tunnel, and you guys, if you aren't, you're going to experience that because you're working in a very small area. That's when the median nerve gets some trap, and that's the big one. And tennis elbow, that's another one I see. You guys know what tennis elbow is? The level epicondyle gets inflamed. Those are the ones I see a lot of in the office. When I'm talking a bit more about the lower part of the back, because I see a ton of that, particularly with your profession. Now, why do I see a lot of you guys in the office? Because your workstations are horrible. Okay? You're sitting down, I go to the dentist also. You're sitting down, and you're on a very small stool or chair, and that's it. And you're bending in different directions, and you're bending over, right? Like this. And you're like this for a long period of time. So not just like for a second, the patient is there, and you're bending over like this, right? Could be 20 minutes, a half hour, right? And the next person, it comes over, you stand up for a second, and boom, I'm back here again. So you do that year after year, hour after hour, bad things happen towards the lower part of the back. Now, how many vertebrae or bones in the lower part of the back? 5. They're 5, 4, 3, 2, 1. Again, you want a normal curvature in there, and from the front to the back, it should be nice and straight. Okay? The problem being is that when the spine is flexed further forward, the lower part of the back takes a lot of force. And when that happens, it starts to degenerate. So I've got a spine and one over here.
I got it.
So this is a normal looking low back here. Big bone, big disc space, big bone. Okay? Phase 1. Bend over for long enough, the disc gets thinner. Okay? These people are where you guys are going to be a decade from now. Okay? They can do nothing about it. Because I see a lot of you guys in it. And all of a sudden, this is where it leads to. Okay? The disc space is thinner and our arthritic bone spur formation. Remember that same concept is within the neck. And then this is not the good part. Okay? It's awful. So the question is, how do you avoid getting there? So I can tell you a lot of different things, but I'm going to give you a couple of things that you guys should do. Number one, when you're in your workstation, try to get a stool or a workstation which has got an armrest. Volvo did a study about 20 years ago now, and the study's been done again and again. And And they found if you use armrest on a car or armrest on a chair, it can take up to 52% of pressure off your lower back. So if you're going to sit there on all day and use the armrest on a chair, half the pressure is taken off your back. So armrest help, okay? The other one are some exercises. So I can give you 100 different exercises to do, but I'll give you a couple of small ones. So Elmore will just show you a right now. We're working on the iliopsoas. You guys know the iliopsoas? It's a big muscle. I'll talk about that in a second. And the piriformis. So she's sitting down in the chair. Very simple. You can bring one knee up towards her chest, hold it for 2 seconds. 1001, 1002, 1002. She drops it down. She moves the same knee up and moves up towards the opposite shoulder. And now she's working more on the, okay, you got that one? That's the iliopsoas stretch.
I think we might catch up with you.
Okay. So the piriformis and the psoas, I'm going to talk about those two muscles. The iliopsoas is a big muscle, okay? You have your spine, starts in the lower part of the back, and it wraps around and surges towards the leg. It is a hip flexor, so it moves your hip in this direction. Okay? Gigantic muscle, the size of your forearm. The problem being is that when your spine is in normal alignment and those muscles are equal, everything functions well. But when you're bending over and twisting, as you guys are, sitting down and twisting all the time, looking, those muscles become tighter on one side. So when you come into my office or into someone's office, we do a couple tests with you. We ask you to bring your leg up and bring it down. And when you bring your leg up and down, we will look at your back, and whatever side is tight, you'll feel a little shimmer in the back. Of the iliopsoas, snapping over the bone is so tight, the muscle is so tight that the tendon snaps in, and you're going to click, 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 click. There you go. You see that?
That's really bad.
And that's what happens. So those two stretches there, and Elmer has some handouts for you. There's some more other stretches in there that will definitely help you. Okay? So that's what you want to do for the lower part of your back. Okay, so we got the most part. Any questions so far? Oh, please, great.
So you know how, like, there's like controversy of cracking your knuckles is bad, cracking your knuckles good, and then you have that guy who like cracked one hand for like 60-something years and then nothing happened.
Right.
So like, I crack my neck a lot and I crack my back a lot. So like, should I not be doing that?
I'll tell you what, the knuckle, there's good and bad about that. Even my middle son, who's 16 years old, and knows that he doesn't listen to me. The sweet crack is and there's been research out there showing either good or not so good. It's one of those things. So that one there, I'm not never worried about it. The neck and low back, though, I am. Because research out there shows that what ends up happening is that your neck, every vertebrae should move its own movement. So what ends up happening, when you have what we call a subluxation, where an area of your spine is not moving properly, the areas above it and below it will compensate for it. So what ends up happening is when you crack your neck or your low back, you're moving areas of the spine that are moving too much, even more. So people will say, but it feels so good. I go, yes, but it comes back quickly. Yes, you're right, it does come back. I said, that's why, because you're moving areas which are moving too much, even more. Well, what we do is we try to get areas which aren't moving properly and get those moving. Okay? Is that an answer? Okay, good. So yes, yes, and no. Okay. So I don't know where I'm going to time, but I'm coming towards the end. But if you guys have any questions, ask away. Okay, ask.
To see a chiropractor, do you need a referral and you just come to your office?
Just walk on in. I'm one of the, I think there's 6 primary healthcare practitioners. I'm one of them. Medical doctors, chiropractors, dentists is one of them, so you don't need a referral. You just walk in and when we're good to go. It's the same as your dentist. Okay. Good question. See that? Right. Now, I'm going to finish off with this. Okay. Now this is. Can you guys see the tip of my finger? Okay. What was her?
Oh, it's purple.
It's purple. Very good. Very good. Now, do you guys think it's painful or not?
Yeah.
No.
No, yeah.
Well, trust me, I can feel it. Okay. So we all agree it's purple. We all agree that it's causing me a bit of pain. Do we agree with that? Okay. Now, how do we, let's say this isn't my tip of my finger. Let's say it's my neck. Okay? Now, my neck should be straight like this, but it's not. So let's say this is my neck right here. It's been going for my dental assistant or hygienist has been sitting around like this for 3 or 4 years, 10 years, 15 years. The pressure is being put upon the area. Okay? So I'm getting headaches or loss of balance, dizziness, just not feeling great, and the numbness in the shoulders. So how do I go about treating this? What's that? Oh, you see, that's a good answer, but that's very, very true. You're spring pants. But that is very, very true. However, a lot of times people out there will go in there and they'll take a painkiller, right? So if I took enough Tylenol right now, I wouldn't feel this. Do you agree? I could take Tylenol right now. Now it's still turning purple, and now it's getting really swollen and painful, right? But I put it enough time. People do that. They take the Tylenol, and I'm not knocking Tylenol. It works. right? Or I can massage it, it would feel better. I've got massage therapists in my office, which work at my office, and they're fantastic. I can massage it, it would feel better. I got machines to put on that would make it feel a little better also. All those things work. If it gets real bad, I'm going to go somewhere and just cut it off. I didn't want to do that, that's what surgery is, right? So it would get rid of the pain feels in there, but it would still, I wouldn't have any pain. Or you do what the smart pants over there says, and you take away the pressure, right? And that's what we do in the office. We take away the pressure, okay? So once the pressure is taken off the area, right, by moving the spine back towards normal alignment, all of a sudden now it feels a lot better, it's always going back and it's feeling good. And then the most important thing is what your philosophy is, and mine, is that once it's like this, tell the person and teach them how to make it straight. So the problem doesn't come back. Does that all make sense? Okay, good. Any questions? Well, please ask.
So if we're thinking about coming in, what are we expecting to have, like, for treatment?
Great question. So people come into my office, there's a bit of paperwork, much like you guys. I mean, you're gonna, what's wrong, let's explain there, et cetera, et cetera, et cetera. Then we sit down with you and we ask you a bunch of questions. You're coming in with low back pain and neck pain, we ask you what that. We ask about other areas also, shoulders, elbows, wrists, hips, and ankles, look at your body in general, the accidents, recently your posture, and whatnot. We do a thorough history. Then we do an examination process with you. So we'll do chiropractic test, orthopedic test, neurological test, postural test, range of motion, a bunch of different tests. We'll do x-rays if needed. We have objective tests that we'll do with you also, so we'll get better at the x-rays are the big one. Then, after that, I put together a program of what it would take to get your spine or your body from where it is now back to the optimal level. And that's called report of findings. And then with that one, that's always a fun visit. We'll come in, I show them the results, and I show them the x-rays. I've gone, patients see the x-rays, to me that's a wow. They go, wow. Because I don't even tell them, I wait, I tell them what normal is, I show them normal, and then I ask them, I said, so what do you think you are? And 95% of the time, people are 100% active. They're not doctors, they're just normal everyday people. They come in and they say, yep, I can see right now, I'm in towards the phase 2. Yep, I can see that. Yep, for sure. I go, absolutely correct. So what's happening? Well, your spine is, my spine's straighter than what it should be. The discs are becoming thinner. Is that what you call them? So, yeah, we call them. And so what's happening? And then what would happen if you did absolutely nothing? I'd be over in phase 3 right now. You're absolutely correct. So it's up to you. What do you want to do? So it's that process. And then if there's something that we can do to help them out, then we will. And we'll tell them what we can do, what we can't do, and how long it will take. And often I've got to see those all those important questions. And if there's something else, sometimes we'll find something where I say, that's not a chiropractic issue. That's something on my scope. I send them off to somebody else. Okay? So it's pretty straightforward. And I've been doing it for a long, long time now. Oh, please, question.
What if the head feels heavy? It's not the neck, it's just the head.
Yeah, so sometimes people will come out of my head feels like 1,000 pounds. I've been told that many, many times. So what ends up happening is that the nerve supply, mainly from the upper part of the neck, that leads up and towards the brain. You get that feeling of heaviness or sometimes dizziness, loss of balance. That's the C1 and C2. Those nerves there travel up and towards the skull. That's the sort of symptom people will come in with. Heaviness within the head, loss of balance, dizziness, those issues there. The ones in the lower part of the neck will come in more with neck pain and more tension headaches and whatnot. So yeah, somebody comes in and they tell me initially my head feels really heavy. Already I'm thinking C1 and C2. How I do the testing with them to see what it is, but that's really what the blood is. Okay. Any other questions?
How could that be?
Well, that's a great question. You see, the number one, you want to find out for sure if that's the issue. If it is the fact that you've initiated from C1 and C2, then you got to sit down with them. I would do X-rays, making sure that is indeed the issue. Then you would go through, we talk to you about some exercises to do that will help that out. You would come in for some adjustments, which is when we move the vertebrae back towards the normal alignment. And then we talk to you about how you fix it and you strengthen it up. So yeah, it's a process to get you back in normal alignment. Any other questions? Oh my God, you guys are keen.
So for our profession, I think no one was assistants here in the past. So we're just starting out, and obviously even with our profession and your profession seems like we're really big on prevention. So when should we start to come see?
Well, you see, it's funny, Eleanor asked me that. I tell people, much like you guys, if it was just a dentist talking to a bunch of chiropractic students, he would say, come in and see where your teeth are already in good shape. Much easier keeping you feeling good than it is getting you feeling good, right? So, and you guys are big on that. Exactly philosophy as me. I mean, I tell people, best time to see someone is when they're already feeling great. I'll be honest with you, most people do not do that. You guys have done a much better job at educating patients than what we are. You know, a lot of people already know, like my kids go see dentists now, and their teeth are overall, the checkup and the cleaning, everything's all said and done. I do see kids come in and say, well, here's the kids come in, and people from Algonquin, and there is people who come in. Generally, they come in pain, and then we get them out of pain, and we educate them what we are today, and understand that. So I would say, just come in for a checkup. If everything's fine, you know, as saying is good, we'll see you back in 6 months or a year, and we'll see how things are. So my profession and your profession are very similar on a philosophical point of view. And that's what I like about you guys. That's why I think you guys make good patients. And I know you do. I see a lot of you guys. So once I get you out of pain, you guys understand the concept of coming in once a month, or once every 2 months, or once every 6 months for a checkup. They go, yeah, I'm a dental assistant. That's what I tell everyone to do. I'm doing that. Right? So I think your philosophy, what you're taught here, sort of sticks in your brain, and then you sort of understand, okay, you know, everything he's saying is pretty much what my dentist is saying, and what I've been taught here, get yourself checked up and maintain that. So I would say as soon as you can. Okay. Any other questions? Wow, good. So enjoy the Star Wars scarves. We're all good with that. Great. I don't know how long we're. I told the timer for 20 minutes, so it should be about 20 minutes.